having completed my primary and secondary survey, I'm now in a position to triage the injuries I've identified and move forward with actual treatment. And let's just quickly recap. I'm looking for bleeds and broken bones, and of those two things I prioritise a bleed ahead of a broken bone. If I have more than one wound, one area that's bleeding, then I also need to triage or prioritise within those. And the simplest way to put it is the larger, deeper wound closer to the vital points that we discussed in the previous video, the higher up the priority list that wound will come as far as triage goes. So I've identified a wound. I now want to get into actually treating it. And for that, I need you to remember sleep, because these are the stages that we're going to go through in our wound management. So looking at sleep, first one, S, is to stop unnecessary movement. Now, quite simply, at this stage, there's probably going to be some sort of shock type symptoms being manifest in ourselves, and we're going to discuss shock a little bit later on in some more detail. But quite typically that's going to lead to a degree of agitation or sort of pacing or similar. And any excessive movement is just going to be raising my heart rate even further, which in terms of the pump that's pushing blood around my body, or in this case possibly blood out of my body because I've got a wound, that's highly undesirable. Okay? I need to be focusing on getting the symptoms of shock under control and also my heart rate as suppressed as possible. So I stop unnecessary movement. Then we come to the L. So the next thing we want to think about is getting low. So again, sympathising with the symptoms of shock, but also our wound management, I want to be sitting down is good, lying down is better. And that's very dependent to the circumstances and environment that I find myself in as to how low I can actually get. That ties in nicely with the point we're going to come to in just 1 second. The E, the first E, is we need to expose and examine the wound that we're going to treat. So when I did my secondary survey, it might be I was aware there was blood on my hands, but this was just a very sort of cursory preliminary inspection identifying the area of the wound. Now I'm really going to take a good look at that wound and see its size, its depth, and any complications around that. And the main complication we're looking for in the beginning is there a foreign body still present in that wound? Now, for an example, that's, the knife is still sticking out of me. In that case, the first and highest priority to remember is do not remove the foreign body. We leave it in place, purely because we don't know the damage that's going to be caused by actually removing that. Okay? So if there's a foreign body in the wound, we leave it in place. If there's no foreign body, great, that makes our treatment even simpler. So I expose and I examine the wound. Immediately having completed that, I want to elevate that wound. Now at the minimum I want to elevate the wound above the level of the heart, but ideally I want to elevate that wound as high as possible. This is basically using gravity to assist already the blood flow being drained away from that wound site. So if you imagine, if you left your arm up in the air for sort of 30 seconds a minute, already you feel your arm sort of starting to fall asleep, and that's because the blood flow being reduced actually to that limb. So the same in this circumstance. Before I do any other treatment, elevating that limb above the level of the heart starts to reduce the blood flow going there. Now again, from the lying position, this is where it's good, because if I'm lying down, effectively anything raised above the ground is above my heart level. So especially if I'm treating lower limbs, then it's going to be very, very difficult to elevate that above my heart from the standing or sitting position. Hence why the lying position is so preferable, if it's safe to do so. So I've elevated that limb. Now I want to apply pressure. Now if there's no foreign body in the wound, that pressure should be direct over the site of the wound, and as much pressure as I can possibly bear on that wound site. If there's a foreign body in the wound, for example purposes, the knife is sort of sticking out, what I want to do is close the edges of the wound with as much pressure as I can bear either side of the foreign body. Now, because we're self-treating, we're going to allege effectively have very little, if no, medical equipment available to us. So this pressure is probably going to come in the form initially of just a hand being placed on the wound. But with our wound management, there's two priorities we're effectively trying to address. That's one is to stop the bleeding, and two is to minimise the risk of infection. So if I do have some sort of non-adhesive absorbent material to press on the wound to help manage the bleed, that's good. And if that is sterile or somewhat clean, that's better. So, in an ideal world, I've got some sort of wound dressing available to me. If I don't, then I just have to improvise and adapt in the circumstances to the best of my ability to impart that pressure onto the wound, absorb the blood that's there, and minimise the risk of infection. The more remote the region that we find ourselves in, the more concerned I am about the infection risk. In the sort of urban or city environment, the infection risk isn't quite so great because I'm hoping that within a matter of minutes, if not hours, I will be at the medical facility, and the cleansing process of the wound management they will do will further reduce the infection risk. Okay. If I have multiple wounds, obviously once I've treated one, I need to move swiftly on to the next. And that's where the ability to improvise dressings or bandages is going to be really, really vital for me. If I'm using my hand to apply pressure and I'm minimising the blood loss that way, and I need to remove that hand to put to another wound, obviously there's a real risk that this wound's just going to kind of carry on exactly how it was before. Then I need to be tying sort of improvised dressing or bandages on me to keep some pressure on that wound. Now, this is an excellent training exercise you can all do at home, is to just look at what you routinely carry with you or have on you that you could, use as an improvised dressing. And again, actually practice applying those dressings to yourself so you get relatively comfortable in being able to do that. Bear in mind, if it's on one limb, you may be having to apply these dressings sort of one-handed and things like that. And that's definitely something, if you feel that this skill is something you're going to have to use, you should be training with this well in advance of any kind of situation you may come across where this becomes relevant.